Understanding the ultrasound and color. Doppler imaging findings of a small angiomyolipoma, AML, of the kidney is essential for accurate diagnosis and management. On grayscale ultrasound, small AMLs are typically presented as small hyperechoic lesions that are well circumscribed within the renal cortex. The increased echogenicity is primarily attributed to fat content within the tumor, providing a distinct visual characteristic. Measuring typically less than 4 centimeters, smaller lesions usually exhibit a homogeneous echotexture, devoid of calcification or cystic degeneration in uncomplicated cases. This clear recognition on grayscale imaging is paramount for differentiating AML from other renal masses. When utilizing color Doppler imaging, most small AMLs display minimal to no vascularity, a key differentiating feature. In contrast, larger AMLs might reveal some vascular signals due to the presence of dysplastic blood vessels. However, the distinguishing trait of small AMLs lies in their typically avascular status, suggesting a benign nature. The surrounding renal parenchyma typically appears normal, further affirming the benignity of these masses. This imaging pattern aids in differentiating AMLs from more concerning renal pathologies, enhancing the confidence of clinicians in diagnosis. Differential diagnoses of AML necessitate careful consideration. Renal cell carcinoma, RCC, may mimic the hyperechoic appearance of AML. However, RCCs often present with internal vascularity on color Doppler and may possess irregular margins, warranting further evaluation with CT or MRI as necessary. Renal lipomas, while also hyperechoic and composed predominantly of fat, are less common and lack the vascular features associated with AML. Rare juxtaglomerular tumors tend to be hypoechoic and can be linked to hypertension due to renin secretion, whereas oncocytomas usually present as hypoechoic or isoechoic and may feature a central scar in larger manifestations. Prognostically, small AMLs measuring less than 4 centimeters in asymptomatic patients have an excellent outlook, being benign entities with a minimal risk for complications such as hemorrhage. For these cases, routine follow-up imaging is typically adequate, particularly when there is observed stability of the lesion. In contrast, larger or symptomatic AMLs, especially among women of childbearing age or individuals with conditions like tuberous sclerosis, may necessitate more proactive intervention owing to the higher risk of hemorrhage. Thus, timely and precise imaging evaluation not only aids in diagnosis, but ultimately influences patient management and outcomes.